Dr. Drew McPhail is back, and not only does he treat your chronic pain at his chiropractic offices, but he's also a writer. He joins us now with his new book, Neck Pain, and here to tell us all about it. Welcome. It's a little different setting for you.
Thank you, Erin.
I like this. So when did you write this book?
Well, we put it together. It takes a little bit of time to put a book together. It was finally published probably about 6 months ago. We finally made it out. But what we did, I worked with a network of doctors nationwide, and we kind of pooled all of our knowledge together and put together a good self-help book. It basically goes over neck pain, what the different causes are, and what you can do to help it.
That's interesting. So you said you work with your colleagues, a couple different doctors in there. Are there different theories, or are you guys all pretty concise and agree on what should be done for certain neck pain?
Well, we meet several times a year, basically go over the latest research and technology, and that's how we stay abreast with what's new and what works. And it makes it easier when we all kind of pool our knowledge together on our different specialties, because everybody's got different specialties that they work with, and we bring it all together to put together a pretty decent book.
Is neck pain your #1 complaints with your clients?
It's very common.
Yeah. Is that because of computers and what we do?
Computers, texting,
yeah.
Basically just daily activities, driving your car, athletic injuries, just looking down, everything puts us in this posture here, and we're not designed to be that way.
Yeah, so reading this book, what kind of things are we going to learn from this?
Well, it goes through everything like how to properly put your workstation at your desk, how to lift your children, how to carry your purse.
Oh, we need to talk, I'm sure.
Basically, it's pretty thorough. It goes over basically all sorts of daily activities and what the proper way to do it, and if you have been doing it improperly, how you can resolve those problems.
We have a lot of women watching this show right now. How do we need to carry our purses?
Well, you need to take a lot of the stuff out of it.
#1. Okay. Too heavy?
Too heavy. That's the main thing.
Should we switch shoulders? Like, because if I always have it on the same shoulder, should I switch sides?
Well, yeah, that would be an example of a repetitive stress if you carry it all on the same side. So if you switched it, so you start working the muscles.
It's also easy if we just listened, right?
Right.
So that's one of the things that you learn in there. And then, of course, if someone needs more thorough treatment, they can go to your offices. You're an expert.
Yep. We offer several different technologies for neck pain, whether you have herniated disc, bulging disc, spinal stenosis, or just tension in the neck. A lot of times there's postural changes that occur due to those repetitive stresses. Like on a daily basis, when you're sitting there texting like this, eventually the ligaments will begin to stretch, and it brings your head out in front. Well, as that occurs, it starts to bring you forward, and eventually you end up that little hunched over person, and it could be prevented.
So cell phones are a downfall.
Yeah.
One of them.
As long as we have cell phones and iPads, I have a job.
You have a job. Where can people go? First of all, where can we buy the book?
Okay, at my office at 1709 Old Trolley Road. You can also go to my website at McPhailClinic.com.
Okay.
I am having a workshop this afternoon.
Tell me more about that. I know people love those.
Okay, we have a free seminar at 3 o'clock. It's going over the common causes of neck pain and back pain, and what some of the common presentations are, and how we're able to effectively manage it without surgery or injections.
All right, Dr. McPhail, always a pleasure. I find myself sitting up a little straighter.
That's
I feel like you're analyzing me.
People do that when they're
Good posture around Dr. McPhail. Thank you so much for being here.
Thank you,
we've
Erin.
got much more on Low Country Live right after the break.